Thank you for watching. For sponsorship and advert placements, please contact 080-3688-61.
Optimistic. Actually, okay, I have it already. What is the next step?
Yeah. So this is the reason why we're talking about it today.
Yeah.
So that, see, the more you know about a course, or the more you know about something, the more you define something, the more you find out what something is. It reduces the fear level.
Then it's actually okay.
It makes you knowledgeable. Yes.
So you say knowledge is power.
True.
And what you do with that knowledge is what it means by knowledge is power.
Yeah. So what can you do when you hear that, when you hear cancer? So do you run, or do you start asking questions?
Yeah.
So the important thing for us today is creating awareness and debunking myths and misconceptions
around surrounding cancer. And the number one myth and misconception about cancer is cancer a death sentence?
So is cancer a death sentence? So cancer is not, just like I said, cancer is not a death sentence. And for you to be diagnosed with cancer doesn't mean it's the end of the world. There are many things, according to NCI, there are many things that would dictate whether this cancer is a deadly one, or this cancer, depending on where the cancer is located
and the type of what type of cancer
it is, and then
how rapidly
it's growing. So these are the things that make you know whether cancer is this particular one is going to be a death sentence or not. And then depending on what organ is located at,
and how early
it is being diagnosed.
Yes. And how regularly you treat it. Because cancer it grows rapidly, or it reacts rapidly. And once you touch it like this, the rate at which it grows
becomes more rapid.
So when, like, for some cases whereby some people they have been diagnosed that they have cancer, right? And they have started treatment, and then they went back and they got like this withdrawal symptoms. But they start going, like we said, start going to spiritual house, or one babalawo house, to another, that they have somebody that if you take these herbs, it will disappear and everything. They're giving the cancer that space to actually grow from the level it was before. And when the process whereby you actually go for another diagnosis or go for another treatment, it has passed the stage.
Yes, it's just like you started a journey,
Yeah.
and then you cut it short
And
with,
you go
because for me those things are distractions. So if you can, in as much as it's very important to pray
yes.
and all that, but you've started a journey already. You started you've already started a path.
Yeah.
So it's better to continue on your doctor's instruction.
Yes, and we Nigerians, we are fond of actually starting a treatment in the hospital, then we'll stop that treatment and start going to other places that if you take this particular thing, the cancer will disappear.
This is the point. Yeah.
If you go through with your chemo.
Yes. So this is the point where a pro doctor will say, Nkechi and Emeka, come here.
Open your ear
and come here. So when you start a treatment, it's very important that you get finish. Yes, finish it up. Even because not going.
It grows rapidly. Once it is touched, it's like a boil. Once they touch it, and you go back and go and read that, it spread.
Yeah. So cancer is not a death sentence. So that's
pending.
On your doctors, what your doctor's report is, what the doctor's diagnosis is, what your treatment is going to be. So when all those things are considered, cancer is not a death sentence. Yeah.
And another misconduct is we eating sugar make my cancer worse. No. No, eating sugar will not make your cancer worsen, because although cancer cells have been
researched,
proven to consume more sugar, but eating sugar does not make the cancer worse, or neither you stopping of sugar shrink the tumor.
Yeah.
It doesn't have any effect on your cancer or anything.
Yeah, so this is the point where you hear, okay, it's important
when you are diagnosed with cancer, you start stop eating this, stop eating sugar, stop taking this, stop taking this.
Yeah.
Does not actually have effect on its cancer itself. That doesn't shrink the cancer. That doesn't make the cancer go beyond the stage it is.
So if taking sugar has any implication with your obesity, maybe, or any other thing, yes. But when it comes to,
because it has been researched that cancer have relationship with being obese.
Yes. So aside from obesity and all that, sugar has no
relationship with cancer.
So the next on our myth is cancer contagious? Cancer is not contagious.
Cancer is not a communicable disease.
It is not a communicable disease. It's not one of the communicable diseases we're taught in primary school.
Yes, like cough and
cholera and the rest. It is not a communicable disease, and
cancer does not jump from one person's body to another person's body because you are being in contact with someone that have cancer.
Yeah.
If it is like that, that means almost all the doctors will be diagnosed with cancer.
Yes. So the only implication here is, or the only situation that can cause cancer to be transferred from one person is when an transplant is being done for you, and if that person whose organ was given to you has a history of cancer, that is okay. According to NCI, they say the chances are like, is it 10%? Yes, he said the chances are very low that you would even get cancer from a transplant.
And doctors try as much as possible to avoid using the organs of people that have cancer.
Yes.
Or history of cancer before. So no, cancer is not contagious.
It is not contagious.
According to
NCI. Yes.
So we are reporting to you. We are not saying from
yes.
from our head.
Yes.
So we are reporting according to National Institute of Cancer.
Yes.
No, cancer is not contagious.
Cancer is not contagious.
So another myth, like attitude, either negative or positive, does it affect the risk of someone having cancer, or does it actually cure cancer? How would I put it? You can't give that type of news, that huge news like cancer, and expect somebody not to feel sad or go into depression. So no, your attitude, either positive or negative, does not have effect on either you die of cancer, either you're at risk of dying of cancer, or you're at risk of getting a cancer, because it's emotions, right? You're dealing with emotions, and cancer. even if anybody that have heard the news of someone have cancer, you react negatively.
Yeah,
You react
most of the
negatively, yeah,
times.
most of the time. So you react negatively. So no, it doesn't have any effects. It doesn't have any effect on you whether you either have the risk of contacting it or having a long life if you are happy or you are sad. No, it doesn't.
Yeah, so the only thing attitude does is that when you're going through cancer and you have loved ones around you, so and you are cheerful about it, it can help you to just be socially.
Just like now there's some people that are shisha.
Yes.
See live your daily life,
yeah.
surround yourself with people that love you, go for parties if you have the energy,
If you can,
if you have the energy of attending parties and all. But apart from that, does not have effect on whether you die of cancer
or whether your
at risk of
treatment will be positive
or
so
negative. No,
attitude whatsoever does not. But in as much as it is good to maintain, it's always good to maintain a positive attitude. Yeah.
towards
Yeah.
anything.
So we're going to take a short break, and when we return, we'll talk about another myth. Will cancer get worse if exposed to air? So stay with us.
So welcome back, guys.
Yeah.
Yeah.
So the next on our myth is, can cancer surgery or a tumor biopsy cause cancer to spread in the body? And the answer is the chances that cancer will spread to other parts of the body is extremely low. Okay,
according to NCI, National Cancer Institute.
So because you have cancer in one part doesn't mean that cancer is going to spread all over your body.
Yes.
It's not, it doesn't happen like that. So according to them, they say following standard procedures, surgeons use special methods and take many steps to prevent cancer cells from spreading during biopsy or surgery to remove tumors. So you having a tumor doesn't mean.
So in a way, if you have cancer, let's say cancer of the lungs, and you have cancer of the breast, the equipment they use to actually remove the tumor from the lungs is not the same equipment they use to remove the tumor from the breast. So that is just it. So they are very, very careful with that. Yeah. They take precautions with that.
So cancer cannot spread from one body to another body. It doesn't work like that. So
there's the other one. Will cancer get worsened if exposed to air? No, it will not get worsened. For those people that say, you have cancer, go and wear cardigan. You have cancer. It might be because of the treatment they are undergoing, which is the chemo. They might have malaria and all. That one is understandable, whereby they are feeling cold, ask them to wear cardigan and cover themselves up. But exposing yourself to air does not increase your risk, or does not worsen the cancer or the tumor. No, it doesn't.
So cancer does not spread. Air does not help cancer spread in any way.
It does not eat the spread of cancer.
Yeah. So another myth we have is, do power lines cause cancer? When
you mean by power lines, we see those electric power lines that run through our house, whereby they say no, give this power line to a particular meter before you reach your house. It's not because of cancer, it's because of either in case of electrical outbreak, because of fire, so that your house will not catch fire. So people used to say because it is radiating
the radiation,
because of the radiation, and when you get exposed to it, you have cancer. People say you have cancer of the skin. No, it's not because of that. electric
So
power does
so
not
so power lines does not aid cancer
cancer.
in
Yeah.
any way. So
No, no,
there's
no, no, no,
no
no.
research that has shown us. So this is according to National Cancer Institute. So
Yes.
the next is, are there herbal products that can cure cancer?
No. Although some studies suggest that an alternative or complementary therapy, including some herbs, may help patients cope with the side effects of cancer treatment, like I say, which is chemo. No herbal products have been shown or be effective for treating cancer. In fact, some herbal products may be harmful when taken during chemo or radiation therapy because they may interfere with how those treatments work.
So
Please,
so this
so
is for us to be wary of people who say they have treatment for cancer.
yes,
How?
take this particular herbal product, it will shrink the cancer. Take this particular thing, it will make the cancer disappear.
How?
No, it doesn't. I think they say pawpaw leaf, right? It actually give you strength, like this, like they say, because of the treatment you undergo,
Yeah.
whereby your system will be weakened or anything.
Yeah.
So all
So
this
there are herbal things you can take that rejuvenate
rejuvenate
you.
yes, to rejuvenate it. No, it does not cure the cancer. And rather, some herbal products actually interfere with
Your treatment.
So please, before you take any herbal product, consult with your doctor before you take
Before
anything.
anyone says
So that
they have
know
a
the
treatment.
components of that herbs, because even herbs are chemical. They contain some chemical product substances
Yeah.
that might interfere with what you are taking already for your treatment. So, like we said, consult your doctor to actually know if the chemical product or the chemical substance in the herb is okay for you to take before you actually take it.
So because someone else went through cancer, they went through chemotherapy, they did this, they did that, and they're sharing with you of their journey, doesn't mean you should also take what they take. See, it's
Yeah.
always important, just like Zuli said, to go and confirm from your doctor, is this good for me? Is this
Yes.
okay?
Yeah.
Maybe the person that was telling you her own cancer case, she did this, she did. Maybe she was talking about breast cancer,
Yeah.
and you're treating
Lung
some lung cancer,
yeah.
and you're trying to do the exact same thing. No two people are the same,
Yes.
and no two procedures are the same.
Even when you have breast cancer, I think it's not the same treatment they give each other.
It's not. Yes.
Your body system, your cell is different from this person's cell.
Exactly.
And the stage where this person's cancer might be different from the stage your cancer is.
So it is important you ask questions, and it's important you ask the right person.
Especially when it comes to issue of cancer. Don't just do because they say this particular person did help for this person and the cancer disappeared. No, please ask questions. Be learned. Ask, like we said, ask questions.
And the right person.
And from the right person.
Yeah. So another myth we have is, if anyone in the family has cancer, am I likely to get cancer too?
There's possible, yeah.
So, but not necessarily.
Yeah.
So there might be cancer is caused by harmful changes, mutations in genes. So there might be some genes in the family inherited, but it is very less likely that these cancers are called, okay, the cancers that can actually be in your family are the ones they called hereditary or familial cancers.
Yeah.
So he said the 90 to 95% of cancer are usually caused by mutation and happen during a person's lifetime as a natural result of aging and exposure to environmental factors such as tobacco, smoking, radiation. So if no one in the family has cancer, does that mean I'm at risk? So no. So when a family member does not mean you likely that you have not exposed yourself to what that person has exposed themselves to.
Yeah.
So and these days, in this time and place where we have tests, where tests can be run, so you can easily find out, can I get, or is there chances of me getting breast cancer because
that is where self examination or going to hospital for examination actually matters. Like,
Yes.
go for medical checkup. They say early detection save life, especially in cancer. Early detection. So sometimes it might be just a tumor, and they just remove the tumor before the tumor
It becomes cancerous.
Yes,
So,
cancerous.
and so some of these tumors are not cancerous.
Yes, yes.
Some of the tumors are removed
Yes.
without them being cancerous.
Cancerous, yes.
So it's more likely that it is just a tumor and it's not really cancerous.
Cancerous.
Yeah. So it's not likely that a family member having cancer also implies that you too will have cancer.
So the last one on our list is, does deodorant cause breast cancer? This particular one, I like it. Do you know why? There is that period where breast cancer was rapid in Nigeria. I like using deodorant for body spray. Some people like, stop using deodorant, stop using body spray. It causes cancer. So that fear of using deodorant or body spray was not in me. Like, to the extent that I stopped buying it, and it's something that I like it because I like smelling fresh because of sweaty and all. So no, they say studies so far have found no evidence linking to chemical typically found in deodorant, which change in breast tissue. So deodorant does not cause any breast cancer according to NCI. They have not found any chemical substance in deodorant that can lead to breast cancer. So those of you that stop using Loron and deodorant because it's cancerous, no, please continue using it to save life, because even the
save the fresh air.
Even the smell from our armpit and everything is something that
it can be very, very toxic.
Yes, so continue using, please. Doesn't cause cancer of any sort.
I remember that period where they said stop using deodorant, it causes cancer and all blah blah blah. That period, I had a family friend that told me her grandmother of 90 years old has been using deodorant
for the past minute.
For years, and she's not cancerous. So it cannot be deodorant.
Yeah, it cannot be deodorant. Like people say that when particular person has cancer, they say, and she used to use pep all the time, and it's not that cause. like we said earlier, cancer can happen due to mutation or environmental factors. So it's not deodorant that actually causes breast cancer. Please, sure you guys can be using your deodorant.
Yes, so please, this brings us back to asking questions, going to the right source, to finding out what medical implications, what can really ask questions. Like when you go to the hospital and you are going for a test, don't just sit down and then the doctor say, you have malaria, and you just go stand up and go
and just go ask. Oh, because when it comes to malaria, what type of malaria, what stages is the malaria?
Yeah.
Because some people, they tell them they'll have malaria, they'll just stand up and go to chemist and
get the medicine, and that's all.
And get normal malaria, anti-malaria drugs. Sometimes you can have malaria plus, and you get this particular anti-malaria drugs and it doesn't work. Why? Because maybe that anti-malaria drug is just meant for malaria plus, not malaria plus, and you go and get it. It will work, like you actually feel relief, but not completely.
Effectively.
It doesn't kill that virus, malaria virus that is in your body. If people have actually asked the doctor, what is that malaria plus I have, and what I can actually take. Kill the virus in my blood.
When you go to the hospital and you pay for consultation, please make sure to use your power of consult. Ask the doctor questions. Make sure to ask him what you can do, how you can prevent. Ask him until you're satisfied.
I think some people is fear. Like they say what you need, like that fear of ignorance. They don't want to know. They don't want to know. They just go like that fear.
You hear people say what you don't know will not kill you.
That's not true. Lie. What you doesn't know will kill you. So when you know the best way to actually tackle it. That is when you live longer. What you doesn't know, like for an example, they say that they have let's say in the scenario by you say there's an accident or a number of boundaries. You continue going and in your mind say what you doesn't know does not kill you, and you go and meet them on the road. So it doesn't make sense. So like Ngozi said, ask questions. Like ask people that ask doesn't they don't miss their way. Please ask questions. It's very, very, very important to be informed concerning our health.
Yes, and so this month from 1st of October down to the 31st of
It's
October
cancer
is a cancer month.
month.
So you find out there are plenty medical facilities
or cancer center
that are going to give free
free
smears.
tests
Yes.
and all
So
that
so
free
let's
consultation.
take
So
advantage of the situation, yeah, and take advantage of this cancer month to find out more about cancer, find out interesting things, find out improved health. You know, formerly when cancer started, people just died. Yeah, so
because of not we don't the knowledge.
we were not knowledgeable about what to
What
do.
cancer is all
But
about.
these days we have many medical procedures, many improved technologies.
Yes.
So find out more about these technologies, find out more how you can save more lives, create more awareness. So we keep
Examine
staying
yourself
healthy. Yes.
and all. It's very important to examine ourselves. Thank you for joining us today. Until next week, stay healthy.
Thank you. Bye.
Thank you for watching. For sponsorship and advert placements, please contact 080 3688 6158.